Hello, and welcome to LMTV Spotlight. LMTV Spotlight shines a light on the people, places, and organizations that help make Lower Merion what it is today. Today, we're going to look at the Gladwyne Animal Hospital. Joining me today is Dr. Carrie Sutor, owner and veterinarian of the Gladwyne Animal Hospital. Welcome, and thank you for joining me today.
Thank you for inviting me.
Of course. Let's start with some of the basics. What is the Gladwyne Animal Hospital, and what does it do?
Okay, Gladwyne Animal Hospital is a companion animal hospital, so we take care of dogs and cats for everything from well visits and puppy and kitten care to sick visits and end-of-life care for people's pets.
And so you do surgeries as well there?
We do elective and also non-elective surgeries if they happen during our hours and within the scope of our care. So we're open Monday through Friday.
Okay.
And we partner with excellent specialty hospitals for care beyond our scope and hours if our clients need it.
Great. So that actually segues into our next question. Where is the Gladwyne Animal Hospital located, and what exactly are the hours? I know you said Monday through Friday, but...
Okay. So we are in the village of Gladwyne, so the historic village of Gladwyne. We are right across from the new McCaffrey's supermarket that maybe everyone is excited about.
Definitely.
And right beside St. John Vianney Church. So right in the village there, and at 1014 Youngsford Road. We're open Monday through Friday. We open at 8 a.m. and we close at 5 or 6, depending on the night. Okay. And our doctors are on call to answer questions 7 days a week until 9 p.m. And we have a separate surgical center that we lease in Bryn Mawr. So we own our property in the village of Gladwyne, and we lease some space in Bryn Mawr to have a very robust surgery center.
That sounds great. Mm-hmm. And so after hours, I'm sure there's places that the doctors can recommend if the middle of the night something happens and you need care.
Absolutely. So we're so lucky here in this part of Pennsylvania and Lower Merion particularly to be so close to Penn Vet. Mm-hmm. So that's always a great option if you have an emergency outside of our hours. And we also have a lot of other privately owned and also corporately owned specialty hospitals, lots of other directions in addition to Penn Vet.
That's great and very comforting to know too.
Yes.
So who can use the Gladwyne Animal Hospital? Is it only Gladwyne residents?
No. So we serve the entire community of Lower Merion for sure, but lots of our clients come still from Conshohocken, even from Philly. I practiced in Philly in Queen Village before I bought the animal hospital, so some of my clients even are coming from Philly still. But
that's exciting.
So we have, all of the towns in Lower Merion, Ardmore, Bryn Mawr, Gladwyne, Narberth, all of our towns we do not discriminate against, but people can come from anywhere.
That's good to know too. Mm-hmm. So how did the Gladwyne Animal Hospital come to be, and when did it start?
So I was so lucky to buy the practice from the veterinarian who owned it since 1967. So his name was Matt Genzer. He was beloved in the community, and he ran the practice by himself for over 40 years until I bought it in 2009 with a partner. And yeah, we try to balance what he had, which was that old school, James Herriot feel of the veterinarian that you imagine from your childhood.
Right.
With everything that people want and need today, which is, online records and scheduling your appointments via text and all sorts of other
those
updates.
Modern day conveniences, right?
So blending that amazing relationship that you have with your family vet with technology.
I also saw that the vet does something, it's fear-free certified.
Yes.
What exactly, can you tell us a little bit more about what that is?
I would love to.
Thank you.
Fear-free certification is a special certification process that I have personally undergone, and all of our veterinarians have undergone, and most of our staff have undergone, and it's a specific class and certification process to really help us and allow us to make the visit for the pet as stress-free as possible. So recognizing those signs that the dog or cat really is not comfortable, is anxious, is, you know, getting upset, which upsets their owners.
Absolutely.
And makes every future vet visit harder, and just really puts that negative association with coming to the animal hospital. And so we really think it's important to make sure that the pets are as comfortable as possible, so that the care can be delivered as safely as possible.
That is so important.
Where we're not getting hurt, the animals aren't getting hurt, the owners aren't upset, and the next visit's going to be just as easy.
Right.
So, and it's kind of a new trend in veterinary medicine, where in the past, I mean, it was really common. I mean, I think people always thought like, oh my gosh, my dog hates going to the vet, or my cat hates going to the vet, or they like, you know, aren't the same for days after, or they're shaking as soon as they get in the car knowing they're going to the vet.
Yeah.
And we're so proud that we don't really have those problems because we practice fear-free.
That's great. So is there specific advice you can give to people who are bringing their pet in for the first time that
Yes.
kind of encompasses that?
Yes. So when you call for an appointment at Gladwyne Animal Hospital, our receptionists are really good at asking you all of the questions to try and start the appointment on the right foot from the beginning, and that starts leaving the house, right? So making the car ride really low stress. So for cats, it's like getting the cat used to even being in a carrier. Get your cat carrier out of the basement, you know, a week before your appointment if you can, you know, just so it's not like all of a sudden this like smelly, dusty carrier that wasn't out since last year when it was terrifying. And now it's out again. So things like just preparing for the appointment a couple of days in advance even can be helpful. And then, you know, the route you take to the animal hospital, so that it's not something that makes them car sick, or lots of little tips.
So it sounds like it's a joint partnership, really. Like you kind of teach the dog parent
Absolutely.
how to get the dog ready, and it's both of you working hand in hand,
Absolutely.
pretty much.
Yeah.
So it's called the Gladwyne Animal Hospital. Do you take care of any type of animal, like horse or sheep, or is it mostly just dogs, cats, maybe rabbits?
So we take care of dogs and cats primarily. If one of our clients happens to have a rabbit or a guinea pig or a hamster, and they're a client with their dog and cat, we're certainly able to give some good advice and potentially do some treatments or examinations that make sense. But none of my veterinarians nor myself are experts in animals other than dogs and cats. So no. But I have gone and seen a pig, a goat, you know, a rabbit, and then given that advice and connected them with one of my friends who is an expert in those areas.
That's so exciting, though, to be able to do that. So for like those special types of animals like lizards or birds or gerbils, you recommend basically somebody else?
Recommend somebody who is an expert in that area.
Right.
But every veterinarian, when they graduate from vet school, has to pass examinations on all animals. So we know enough to give good advice. Or know what we don't know.
Yeah, definitely. Because I'm sure people come in with questions all the time about their other animals, right?
And usually we can get you pointed in the right direction if it's not something about a dog or a cat.
Yes. So what would you say is the most common thing you encounter?
Probably skin conditions, allergies, itchy skin, ear infections, things like that are really, really common. And also tummy troubles. Those are the things that are really common. Probably those are the things that you see when you're a pet owner, right?
Yes, definitely.
So
yeah, I
those
have
are
a
the
dog,
things
so
that
definitely.
you come in for. And then during your well visits or your annual exams, we're looking for all sorts of other things that you might not see.
Yeah, to keep the pet healthy for sure.
Exactly.
One thing I wonder about, and I feel like, you know, most people might not know about it, is you can chip your animal.
Yep.
So for those who might not know, what exactly is the process? What is a chip? What?
So a microchip is a really small, it's almost the size of a grain of rice, stainless steel encased RF transmitter. So it transmits a signal that doesn't require a battery or charging or anything like that. It's totally benign. And when anybody who has a scanner, so every veterinary office, every police station, Lower Merion has scanners. Every animal shelter has a scanner. So when a stray pet comes in or somebody finds a pet and brings them in, we can scan it. And that specific number, if the pet is chipped, will come up on our scanner. And then we can look in a database of chip numbers and see who does this chip belong to. So it relies on the person registering the chip.
Yes, but that's easy to do, right?
So easy. When we place a chip in our office, my receptionist does it for you, and we give you all of the information to say, if you move, now you just need to change your address or your phone number or whatever it is.
Yes.
But we do it for you.
Oh, well, that's great.
Yep.
And it's great in case your dog, ever gets lost or runs away
works.
and, things happen. So
yeah,
it's a great way to reunite. And
I would say it happens to us, I don't know, a couple of times a month that someone brings in a dog that they found wandering, and we scan it, and we're able to quickly, call the owner and say, hey, Fluffy's here, and it's a happy ending.
That's such a beautiful
It's very
thing.
common.
Yeah, absolutely.
And chips make it really rewarding.
Yeah. And so do you have any really interesting story you want to tell about anything you've done, or?
Gosh, there's so many interesting stories. I think one of the funniest stories, and this is related to not a dog or a cat. Okay. One day, a client came in and said, oh my gosh, there is a really sickly looking fox walking up Youngsford Road. And I'm like, oh my gosh, well, let me see. And the fox literally walked up Youngsford into our driveway and laid down by the sign. I think it was almost as if the fox could read the sign and knew where it was, right? I'm just trying to get to the animal hospital.
Aww.
And we were able to, with actually Lower Merion Animal Control at the time, try to get that fox out to the Schuylkill Valley Wildlife Center.
So it had a happy ending. That's great.
Yeah, but it was just, I think the fox could read.
Yeah. Well, I've really enjoyed our conversation right now, but sadly we have to take a break.
Okay.
I've been talking to Dr. Carrie Sutor, owner and veterinarian of the Gladwyne Animal Hospital, but please stay with us. We have more coming up right after this. Welcome back to LMTV Spotlight. I'm Jamie Snyder, and I'm here with Dr. Carrie Sutor, owner and veterinarian of the Gladwyne Animal Hospital. So, before we jump back in, let's get to know you a little bit. Where are you from? Where did you grow up? Where did you go to school?
Okay. I grew up outside Pittsburgh, Pennsylvania.
I'm from Pittsburgh.
You are?
Yes.
Yes, I grew up in Butler County.
That's so funny.
And I went to the University of Pittsburgh for undergrad, and then I, after working for a little over a year for a drug company, I went to vet school at Penn. And that's where I met my husband. He's not a veterinarian, but he went to Penn for undergrad, and then he went to Villanova for law school. So that is how we ended up staying here, and that's where we've been ever since.
Cool. So what got you interested in animals?
So I grew up with animals. I've always loved animals. But more importantly, when I was in college as an undergrad, I studied chemistry. I knew I really loved physiology and chemistry and medicine. And to make a long story short, I went to work for a drug company, and I felt like, oh, I just really still loved learning, and I still wanted to go back to school.
Right.
And I wanted to move to Philadelphia. And I feel so grateful and lucky. I must have had something going for me in my application that I was accepted to Penn Vet.
Wow.
And I began my veterinary career that way, knowing that I just loved medicine and I loved animals, and so that would be a good intersection, and that's how it happened.
So you studied then at Penn Vet?
Yes.
Okay. And do you specialize in any specific area?
So I am a general practitioner,
Okay.
and I take care of dogs and cats, but when any new veterinarian graduates from vet school, they have the option of really practicing however they want to. We've learned everything to have a foundation to treat any pet or any animal. So from laboratory animal medicine to, horses, cows, whatever. And then you can choose to go into general practice,
Okay.
whether companion animals or horses or whatever, or go on for more specialization.
Huh, It's interesting.
Yeah.
So I think we all realize the importance of veterinary medicine. Is there any tips or tricks you can share with us on how to take care of simple things with your pets, maybe how to remove a tick or brush teeth? I mean, I have a dog, and I know that if I saw a tick on my dog, I would freak out. So are there any hacks or tips or anything like that you can?
So removing a tick is important. If you see one, you should remove it right away. So the longer the tick is on, the more likely the tick is to transmit disease. Same with on us.
Okay.
So the best way to remove a tick is to grasp it with a tweezer at as close to the skin as possible and peel it backwards, almost like you're going to make the tick do a headstand. And just peel it off with a tweezer and flush it immediately down the toilet. Or you actually can, in Pennsylvania now, put that tick in a sealed Ziploc baggie, and through the state you can actually submit it for free for, identification of its species or whether it has carried Lyme disease or anything like that.
Interesting. I didn't know that.
Yeah.
So do you bring it to the vet to do that, or do you?
You can do it yourself. We can give you the information to do that. Okay. Sometimes it's more information than you want. Sometimes you don't even want that information. It's not useful.
Right.
But if you really want to know, that's an option. Okay. I actually recommend flushing it and just get rid of it because we don't want it getting back on you.
So after you remove the tick, do you have to bring the dog in to make sure that it didn't get exposed to Lyme or the cat or?
So if a tick is engorged, that means it could have been on long enough to transmit a disease. So if it's puffed up, and it can take up to 5 weeks for that infection to become apparent. Ooh, so there's a great vaccination for Lyme disease that we recommend for all dogs. And there's also excellent preventatives that kill ticks within a few hours of the tick attaching. So that's your first defense against Lyme disease. But if you had a tick that was on and your dog wasn't protected with a vaccination, it's a good idea to get checked out about 3 to 5 weeks after you saw that tick.
Good to know. What about, also another struggle for me is the brushing the teeth, right? The struggle is real for that. So are there any tips you can give to our audience about that?
Yep. Most dogs will only really get a lot of tartar or decay on the outer surfaces of their teeth. So you don't have to go crazy trying to open their mouth and get the inside and get all in there. So I usually tell people to use a finger toothbrush. So at the pet store, you can buy a toothbrush that fits over your finger like a little finger cot, and use pet toothpaste that's chicken or beef flavored, something that's not offensive to your pet.
That sounds delicious.
And then just really go inside the mouth on the cheek side, and just with their mouth closed, just rub their teeth. And most dogs will get used to that pretty easily if you give them a flavored toothbrush.
Right.
And you're not trying to open their mouth. As soon as you start trying to open their mouth, that's when they get fussy. But if you're just going under their lip, you can do it.
And how often do you need to do that?
Every day is best, but sometimes is better than never.
Also,
I tell people I would be a hypocrite if I told you I brush my dog's teeth every day. I do not.
I'm really bad about it, but anyway, I did see on the market there's these, I guess they're called greenies or things like that.
Yes.
Do those work at all?
Yes.
Okay.
Yes. So anything that gives a lot of good natural chewing action is good for dogs. And greenies are good. They have a lot of chlorophyll in them, so it's kind of a natural product that eliminates some of the bacteria that causes plaque and decay.
Okay.
And I usually say, as long as they don't go chomp, chomp, swallow, and it's done, as long as they really chew it up and crunch it up, I would usually do one every other day.
Great. That's good to know. So I gather that you're very busy, which is wonderful. Are you ever looking for volunteers to help? And if so, what are you looking for in a volunteer? Do you need to have special skills?
So we don't generally take volunteers because it's a little bit dangerous for someone to just be standing, watching, and observing. They could get bitten, or who knows. It doesn't happen often, but it can be dangerous for a volunteer. But we love hiring summer help, and we love hiring excellent students from the township.
Definitely. Do you allow visitors like a scout troop or anyone to come visit and learn and hopefully maybe follow in your footsteps and become a veterinarian and save animals?
So I'm actually visiting the Girl Scouts in Gladwyne on Saturday to talk to them about their pet care badge. Okay. So we do talk to the scouts pretty frequently when the troop leaders ask us. Every once in a while we'll have them tour the hospital on a quieter day, but I usually come to them with some pets and stuff.
Oh, that's super exciting. I'm sure they'll love that. What kind of advice can you give to a young person who's interested in animals and are interested in veterinary medicine?
So the most important thing to know is that you really need to study and work hard in school, because it is a really rigorous process to get through vet school. And if you want to be a veterinarian, you can absolutely do it if you're a great student. But if you just love pets, there are so many other jobs that you can do if you're not interested in that type of schoolwork at animal hospitals.
Okay. So you said obviously everyone knows it's hard work, and so you have to put in the time and everything like that. Is there anything that you find to be the most challenging when it comes to being a vet?
So we're so grateful to work in the community we work in, where we care for people who are really committed and dedicated to their pets. And so I love my job, but sometimes it's hard when you can't do anything further to help a patient. And sometimes it's hard, especially for us, when we've seen the patient since they were a puppy until they were, their final years.
Right.
Because we also know our clients so well that we just really care about them.
Yeah, that's so sweet.
Yeah.
All right, so I'm going to ask you to give us a public service announcement, right?
Okay.
If I just moved to the area, I want you to sell me on the Gladwyne Animal Hospital. Why should I bring my pet there? And what is it? What can you tell me to sell it?
Okay. So in addition to having a whole team of excellent veterinarians and diagnosticians and dedicated, skilled staff to really provide the best possible general practice care we can, we're also so committed to the community and just being a part of the relationship that you have with a vet, so that when you call our office, probably Megan or Jess or Chris or whoever's answering the phone is going to be like, oh, Jamie, yeah, okay, Fluffy, how's he doing? What can I do? We really try hard to make sure that you feel like we know you because we care, and that's how it is.
That's so important, right? Because, you want to feel like you could trust who's caring for your animal. I mean, 'cause your animals are like your children. So that's such an important...
And you don't want to have to re-describe every piece of your pet's history. You want to feel known when you come in, and we want you to feel that way.
Yes. So are there any final thoughts, anything that we didn't touch on or talk about that you think that the audience should know about the Gladwyne Animal Hospital, or about taking care of animals in general? Anything animal related? Anything
animal related. I think that having a pet is just such a vital part of people's lives. They're so comforting, and coming into the animal hospital, once a year at least, to make sure that your pet is healthy and aging appropriately, and there are no hidden problems that we can detect and correct, just keeps them healthy for as long as possible, so you have them for as long as possible. So that's important. But I guess that's it.
Like yearly physicals with people, right? So you take care of your child, you take care of yourself, you bring in your pet yearly for a checkup.
And especially yearly for a pet, because, they age faster. 1 year is almost 7.
Absolutely. Well, sadly, we are out of time. I've really, really enjoyed our conversation, and thank you so much for talking to me today. It's been a pleasure, for sure.
Thank you.
You're welcome. I'd like to thank Dr. Carrie Sutor, owner and veterinarian of the Gladwyne Animal Hospital, for being with me today and giving us a look into a valuable service in our community. If you want more information on the Gladwyne Animal Hospital, check out their website at gladwyneanimalhospital.com. And I want to thank you for watching. I'm Jamie Snyder. I'll see you next time on LMTV Spotlight. Have a great day.